We usually go to a hospital when we are hurt in an accident or when we need to have surgery. In a traffic accident, somebody calls an ambulance that comes immediately and takes the person to a hospital where some doctors and nurses are waiting for them. A physician examines the person's cuts and bruises or broken bones in the doctor's office. An emergency room nurse cleans and bandages the injuries. In some cases, it is necessary to have an X-ray in the radiology. If the person breaks an arm or a leg, an orthopedist will use a cast to set their broken limbs. If badly hurt, the person will stay in the hospital in a ward to receive care and treatment. That person is an inpatient. If not seriously hurt, that person will come back home and go to the hospital for care and treatment from time to time until fully back on their feet. That person is an outpatient. Doctors carry out operations in the operating room where there are a lot of pieces of surgical equipment and an operating table. A circulating nurse helps lay the patient on the operating table, and an anesthetist gives the patient an injection to put them to sleep. Then a surgeon comes with the surgical assistants, registered nurses, and a scrub nurse, makes an incision with a scalpel, and carries out the surgery that may take only a few minutes or several hours, depending on the medical procedure. After the surgeon finishes the operation, the scrub nurse takes the patient to the recovery room. A few days later, the patient will be able to walk with a spring in their step. Doctors are able to do any kind of medical procedure at a hospital, from the easiest one to the most difficult one. A dentist fills a cavity or pulls a tooth in the dentist's office, and a cardiologist transplants a heart in the operating room. A hospital is not necessarily for people who are hurt in an accident and need primary health care. At a hospital, there are specialists in all kinds of illnesses who give secondary health care to patients who need special treatment for a specific disease. A day patient or an index patient receives better assistance at a hospital because there are all kinds of medical equipment, an intensive care unit, a laboratory for tests, and a pharmacy which are at hand in case of necessity. The American government provides medical care for some citizens, but not for visitors. Most people who live in the USA have health insurance because health care is very expensive. If you break a leg, you will have to pay about $7,500 for medical care. If you need to stay in the hospital for 3 days, it will probably cost about $30,000. Healthcare in England is free of charge for people who are registered with a general practitioner, have a National Health Service number, and live in that country.